I'm guessing you are at least somewhat hypnotizable. And it's part of what makes you a good therapist, because it's easy to tune into other people, to get the feeling of what they're feeling. Part of what goes with being highly hypnotizable is you can sort of easily take on what somebody else is mentioning might be a new way to be. Well, just engaging with a patient and learning about them and learning how they deal with their problems kind of pulls you in, and you can connect with them because you can not just think about it, but you can feel it with them. So, they become your movie and you engage with it and become part of it. You begin to feel what life is like from their point of view, not just yours. I sometimes find when I'm treating people, and that I'm sort of a spectator at my own movie, because words come to me about what's the right way to formulate this that touches them and connects with them.
Welcome to Therapist Uncensored. Building on decades of professional experience, this podcast tackles neurobiology, modern attachment, and more in an honest way that's helpful in healing humans. Your session begins now with Dr. Ann Kelly and Sue Marriott.
Hey everyone, welcome back to Therapist Uncensored. Before we jump in, just want to make an announcement. If you are longtime listeners, or even if you're fairly new, and you feel like you've gained from all the important material you've been listening to, we hope you will be excited by our upcoming book, Secure Relating, Holding Your Own in an Insecure World. It comes out through HarperCollins on April 30th, and I know y'all can imagine Sue and I are super excited and relieved. So in this book, Sue and I discuss our framework, which integrates some of the most important aspects of modern attachment and neuroscience, but in a way that makes it easy to understand and really easy to use in your everyday life. So just like on Therapist Uncensored, our goal is to help you build secure and grounded relationships with your closest people, whether that's your partner, your child, your best friend, your coworker. We have many primary relationships out there in the world that are important to us, and we want to be part of helping build deep, lasting relationships. We also have another goal in our book, and that is to be part of shifting our collective conversation out there, especially right now, from mistrust, divisiveness, and polarization towards more secure ways of relating with one another, something that we need more now than ever. So if you've been listening to our podcast, we know that you want that too. And we're hoping that we can all join together to really help add to this collective conversation, which is one reason really hope you guys can help spread the news of our book far and wide. And another thing is that we hope our book sounds like a conversation with us rather than just an academic read. But it will give you a deep dive into fresh and modern views on attachment, how culture and systems impact all of us, and ways to build secure relational skills both inside and outside of therapy. You can purchase this book at your local bookstore or find it at securerelatingbook.com. You can jump there or even just to Therapist Uncensored and find out ways to get a signed copy if you are interested in that. All right, let's jump into today's episode. Today, our guest is Dr. David Spiegel. Dr. David Spiegel is Associate Chair of Psychiatry and Behavioral Sciences at Stanford University School of Medicine. He's also the director of the Stanford Center on Stress and Health. So he has over 40 years of clinical and research experience with hypnosis, stress, physiology, and he also practices psychotherapy. And he has published many books, I believe 13, and hundreds of research articles. So he is the expert on hypnosis. And today we're going to dive into what hypnosis is and what it isn't, and how one can use hypnosis, including the aspect of self-hypnosis, to improve sleep, decrease depression and anxiety, improve chronic pain, and shift habits such as smoking and overeating. And that research shows that these changes can really be maintained. So it's pretty spectacular. I really enjoyed that conversation. I learned so much. And Dr. David Spiegel now is also Reverie's co-founder and chief scientific officer. And so in this, he has now a way at a nominal cost for people to be able to use an app to get some of these benefits for themselves right at home. So we are going to learn a great deal from Dr. Spiegel just about mind-body connection. He really breaks down how hypnosis works on the neural circuits to enhance our cognitive flexibility to make the changes that we see in these outcomes. Really fascinating. Hi, Dr. Spiegel. I'm so glad to have you on our program today.
Thank you. I'm delighted to be here.
Would you start by telling us a little bit about your work at Stanford and the centers that you are the director of?
Sure. Well, I've been at Stanford for a very long time, since 1975. And I went there in part because it's a sort of an open-minded place. And I was very interested in hypnosis and mind-body medicine and how people can use their minds to help their bodies and use their bodies to help their minds. And hypnosis was a particular interest of mine. So I started doing research shortly after I got to Stanford about hypnosis and how it works, what effects it has on the brain, on perception, doing randomized trials on hypnosis for helping people undergoing surgery that you don't use general anesthesia for to control pain and anxiety, doing neuroimaging on what happens in the brain when people go into a hypnotic state. So Stanford's been a place that welcomes research of all kinds, and I was able to do mine. So the Center on Stress and Health grew out of that, and that's where we're studying how psychoneuroendocrinology learned to enhance their control over both. The Center for Integrative Medicine I started in 1998 to help introduce and kind of organize the group of people who use various techniques to help people control problems related to illnesses like cancer or difficulty controlling their autonomic nervous systems or dealing with pain of one kind or another, and using non-pharmacological approaches. I mean, I prescribe drugs too, but people who learn to use hypnosis, acupuncture, mindfulness, and other techniques like that, functional medicine, to better cope with their illnesses and enhance their lives.
I love to hear all the science and the research that's being done at Stanford around hypnosis. People don't typically think about research and brain studies and hypnosis. Most of us are exposed to hypnosis with the idea of being on stage and it being something that we're going to be deceived. And yet there's so much rich research and science out there, and I'm excited to talk to you about it. Can you start by telling us what hypnosis really is?
Sure. Well, I'm glad you brought up all those misunderstandings, or I call them myth understandings. We'll see if we can sort it out. Hypnosis is actually the oldest Western conception of a psychotherapy. It's the first time a talking interaction between a doctor and a patient was thought to have benefit. And what it really is a state of highly focused attention. Do you ever have this sense when you're in a good movie that you kind of enter the imagined world and get so absorbed in it that you're not evaluating it, you're not in the audience, you're in the movie? That's a kind of self-hypnosis. You narrow the focus of attention. You're just focusing on what you're seeing on the screen. You dissociate. You put outside of conscious awareness things that would ordinarily be in consciousness, like your body touching the chair you're sitting in or what you have to do later in the day or anything like that. You focus intently because you can put aside things that would ordinarily compete for your attention. And the third thing is the thing that you mentioned already that scares people the most, but is a big misunderstanding. And that is what has been called suggestibility. The image people have is that somebody dangles a watch and you will do anything they want. What it really is cognitive flexibility. It's an ability to try out being different and see what it feels like. People in hypnosis can sort of turn down that superego part of the brain that says, here's what you're supposed to be, and here's what you were raised to be, and here's how you should be, and just says, what if I were different? What would it feel like? And so we found on neuroimaging that parts of the brain that are the seat of this kind of self-reflection can be toned down so that you can try out seeing what it's like to be different. And that's part of the fun and power of hypnosis. You can concentrate on what you want to do intently. You can put outside of awareness things you'd rather not be distracted by. And you can suspend your judgment and evaluation of who you are and just see what it would be like to be different. And as you know, as a therapist, that's a wonderful setting for which people can grow and change because they can just try it out. So rather than figuring out how you got to be the way you are or taking step-by-step approaches to changing gradually, you just say, I'm just going to shelve that for a while and try being different and see what it's like. And sometimes if you like it, you keep doing it.
Well, how do you distinguish then hypnosis from an experience of maybe meditation or mindfulness?
They're different in a couple of ways. There are areas of commonality, but meditation is Eastern. I find it remarkable that it has, taken the West by storm in a very short time. But it's meant to be a practice. It's not meant to solve a problem. So people, are encouraged to meditate half an hour twice a day, something like that. John Kabat-Zinn recommends that. And you don't try to control anything. In fact, control is the problem. So you just become open to open presence. If you're having a feeling, you don't try to argue with it. You don't try to change it. You don't try to use it. You just let it flow by like a storm passing by. Open presence. You're getting over yourself. I don't want to be involved in this. It'll just happen. The second thing is developing compassion, which is a very good thing to do. And the third is trying to focus in a way that allows you to not judge and evaluate, but just to be, just to have an experience, to get over your intentionality. And you also spend some time scanning your body, looking at what's happening in your body, but it is not meant to solve a problem. So it's Eastern. In fact, I had a woman who used our Reverie app who had been meditating for 10 years, twice a day for 10 years. Now that's serious, She said, but you know what? I still have a migraine headache problem, and it's not any different than it was. So I taught her some self-hypnosis to imagine an ice cap, cool, tingling numbness, filter the hurt out of the pain. And she said to me, you know what? I want to thank you for giving me permission to use my intentionality, that I'm allowed to make it better, and it's gone. My migraines are gone. And so hypnosis, the analogy I sometimes use is that meditation is more like a vitamin and hypnosis is more like an anti-inflammatory drug. You use it when you need it. You use it to solve a problem. Whereas with meditation, it's meant to be a practice. So my goal is not to have hundreds of thousands of people walking around in hypnotic states all the time. My goal is to have them have available to themselves a tool they can use when they've got a problem, when they want to control pain or manage stress or stop smoking or whatever it is. So it's directed and purposeful and Western, and mindfulness is undirected and by design not purposeful and Eastern. Now, there are some similarities in what happens in the brain between the two. In hypnosis, three things happen in the brain. You turn down activity in what we call in the anterior cingulate cortex. There's a part of the brain that's like an C on its ends in the middle center of your brain. And the front part is our alarm system. It's called the salience network. It matches patterns. And if you hear a loud noise and you're suddenly wondering what's going on, that's your salience network. You turn it down in hypnosis. So you're just less likely to be distracted by things that would otherwise compete for your attention. You have more what we call functional connectivity between the prefrontal cortex, the executive control network, and the insula. Insula means island in Latin. It's a little island of neural tissue. It's a mind-body pathway. Helps your brain control your body and helps your brain perceive what's going on in your body. We call that interoception. So in hypnosis, you're in better control of what's going on in your body and more responsive to what's going on in your body. The third is inverse connectivity. So when one is up, the other is down between the executive control network and the prefrontal cortex and the posterior part of the cingulate cortex, the default mode network. That's that part of the brain where you're reflecting on who you are and why you're this way and what you should be like and what your parents raised you to be and all that. And you turn down activity to the extent that you're engaged in it, which is why you can try out being different so easily. It's why you're more cognitively flexible in hypnosis. Now, in meditation also, meditators over time begin to suppress activity in the default mode network because a part of meditation is also meant to help you get over yourself and just be. being rather than doing. Hypnosis is doing rather than being.
That's such an interesting difference that really made a light bulb go on for me because, yeah, we talk a lot about mindfulness and meditation and the benefits of tuning down the default mode. But the idea of adding the intentionality and almost giving permission to add the intentionality for something that is going on for you, you're setting an intention of a desire to shift it. While it sounds like you're saying this more meditative state, but meditative state with awareness. Am I hearing you accurately? Like with an intention and a goal, and it's okay to set the goal to focus on.
Right. You use the state to accomplish the goal rather than the goal of the state being not to have goals, not to have intentions, just be. So they're kind of opposites in some ways.
It's kind of funny how you describe the lack of gold being Eastern and the goal driven being Western, because that's so true, isn't it? We kind of are doers and let's solve it and let's be. Would I be accurate to say that the experience of hypnosis is a little bit of the blending of the two, of learning to be with yourself while doing?
Well, there's a sense in which that's true. It's certainly a shift and alteration in consciousness, and both of them are. That is, you're not in your ordinary state of being. You're trying to be different. But in hypnosis, it's more for the purpose of focusing on one thing. I'm going to suspend my awareness of who I usually am and what I usually do. Whereas in mindfulness, it's a sort of slower, more gentle process where you're just practicing being silent and just being and letting feelings and thoughts flow through you. But you're not letting them flow through you so you can control pain or stop smoking or get to sleep. You're just doing it to be that way. So they are both alterations in consciousness, but their structure is rather different.
Can you talk a little bit about some of the outcome that you have studied and found when you're teaching somebody or they've learned this process of hypnosis? In various things, you've mentioned that you see significant improvement in sleep and reduction in anxiety, in habit breaking. Some really, our listeners out there, like sometimes, especially sleep, maybe if we could start with sleep, because there's so many individuals that struggle right now with sleep. And I'm speaking to a psychiatrist, and people often go to a psychiatrist to say, I can't sleep. Could you please prescribe me a medication? Can you describe the outcome and why is hypnosis so powerful with sleep? And what are the study outcomes you found?
Well, of course, the old, movie version of hypnosis is the dangly watch, you are going to sleep. Hypnosis is not sleep. You're actually kind of waking up. You're not going to sleep. But here's why it helps. You get into a state when you're trying to go to sleep, the paradox of forcing yourself to sleep. And the more you have trouble going to sleep, the more frustrated and angry and aroused you get. The more you tense your muscles, your heart rate goes up, your blood pressure goes up. And you're stimulating the fight or flight reaction, the sympathetic nervous system, which is exactly what you need to quiet down, get the parasympathetic system, the rest and digest system, to take over so you can go to sleep. I mean, the alarm clock wakes you up because it sets off this autonomic arousal. What the hell is going on? So you get in this paradoxical situation where the longer it takes to get to sleep and the more you're thinking, oh my God, I only had 7 hours altogether to sleep and I have to get up at 6 a.m. And the more you're waking yourself up. So with hypnosis, we do it from the body up instead of the brain down. We say, get your body comfortable. Imagine you're floating in a bath, a lake, a hot tub, or just floating in space. Taking a nice deep breath and slowly exhale through your mouth. Get your body floating. And then as you get your body floating and comfortable, which is already reducing your sympathetic activation and helping your parasympathetic system to take over. If there's something bugging you or something happened bad during the day or something, just project it onto an imaginary screen as if you were watching your own movie. Don't judge it. Don't fight with it. Just experience it, but out there. Leave your body out of it. So just the process of dissociating your physical arousal from your mental arousal can allow you to sleep. And reverie, we ask people all the time, how stressed are you before and how stressed are you after you do the exercise? How was your pain level when we started and what's it like now? We were doing that with sleep, but we would ask them how sleepy you are before and how sleepy you're feeling after. And unlike stress, where we got, like a 20% reduction in 10 minutes and pain similarly, We weren't getting many people to respond at all. And so we started asking them. And they said, Doc, I just wanted to go to sleep. I didn't want to answer your damn question.
Don't bug me.
Exactly. One of the things that hypnosis is very helpful in doing is getting you more engaged with process and less with outcome. See what it feels like to do this and see how you can change the way you do it and how it feels. The last thing you want when you're trying to go to sleep is being worried about the outcome. Am I asleep or not? So instead, you just want to get involved in a process that allows your body to relax and allows your brain to disconnect and let yourself go to sleep, but not because it's a goal, but because what you're doing moves you in that direction. And hypnosis is very good at focusing on what you want to experience rather than what the outcome is.
So you may start the hypnosis journey that night with the intention of wanting to get a good night's sleep. But I think what I hear you saying is the journey in the self-hypnosis isn't to like, I got to sleep, and to focus on that goal is to get into a state where you can dissociate enough, if I'm using this word a little loosely, I guess, but dissociate enough where you can imagine yourself, you have agency enough to put the worries over on another slate. I can see the process of having the agency to be able to distance from that experience to then intentionally come back to yourself, to come back to, oh, okay, so I'm going to put those worries over there and I'm going to come back to my own lightness. So in this case, the intentionality would be I'm feeling light. I'm allowing my mind to go in this journey of being with my body. Do I have that accurately?
Yes, it's sort of a circular thing and the more you can just be with your body and help it be comfortable, the more you can allow your mind to gradually detach from the things that were keeping you aroused. So it works in both directions. They reinforce one another. And it's that capacity to just immerse yourself in the experience and not worry so much about the outcome that allows you to do it. I had one woman who started using our Reverie Hypnosis app, and she said, I haven't slept in years, and I didn't think it was working, and then I opened my eyes and looked at the clock, and it was 7:30 in the morning. And she said, I can't believe I slept for 7 hours, so yeah, it's wonderful. One of the fun things about hypnosis is the sense of surprise people have, I actually changed the way my body feels, the pain doesn't bother me so much, and people are surprised and generally pleased by that.
Well, and you have so many robust outcomes in your research. I mean, it's really startling. I want to talk about more of that. I really do. And yet the point that's coming to my mind here is why isn't it more promoted? Why is the idea of hypnosis seems so like, woo-woo and kind of something distanced from, and is anybody going to take me serious when you have so many amazing scientific outcomes that shows an improvement in sleep, that shows a reduction in pain? I definitely want to talk about some of the findings you found in that area. And yet it's just so hard to find a lot of people actually promoting it and talking about it. What are your thoughts about that?
You remember Rodney Dangerfield? He was a comedian. I don't get no respect. He said, they asked me one day to leave a bar so they could start happy hour. It's, I don't know what it is. And I expect you to help me with that, please, straighten people out. Most people's memory of it is one of these stage shows, where the football coach dances like a ballerina and makes a fool of himself. And people have said, come up with another name, neuropnology. We tried all kinds of, nobody, everybody knows what it is. They say, wasn't that hypnosis? I don't know what it is. It's frustrated me. But frankly, that's one of the main reasons my colleagues and I started Reverie, is that I wanted to make it available to anybody who wants to use it to help themselves with stress and pain and insomnia and smoking and other things. Because I am really sick and tired of people not giving us the respect that the phenomenon deserves and people not getting the help they can get. And you mentioned with pain control. Last year, 88,000 Americans died of opioid overdoses in the United States. And the vast majority were not suicides because the opioids are potent suppressors of respiration. And people just go to sleep and they don't wake up. It's a horrifying thing. The CDC is expecting 111,000 deaths this year. And hypnosis has not yet succeeded in killing a single person. It's just not dangerous. So I'm just not going to give up because I have seen how much it can help people, how well it works, how easy it is for people to learn. And also, all hypnosis is really self-hypnosis. All people are doing is learning to use the abilities they've already got, identify them and use them. And I'm just showing them how. And that's why, we've had 500,000 downloads, virtually no problems with it at all. And people are having these experiences, not because I'm actually there next to them, talking them into it, but because I'm just showing them how to use their own ability. And so you're absolutely right. It frustrates the hell out of me, but it's the way it is. And I just hope people will give it a try and see what it's like and then take full advantage of an ability they've got within themselves.
Well, one of the things I thought about, and I think we talked about in one of our prior discussions, that if the pharmaceutical companies could show the kind of outcome variables that you can show in your research and actually capitalize and sell it, it would be a whole different story. But what we're talking about is something you can do on your own, that you can really learn to train. Of course, not everybody, we want to talk about that, but that you could do it on your own. You've mentioned Reverie. Let's talk about that a little bit, and then we'll talk more about it at the end. But you've developed an app so that people can sit in their own homes. They don't always have to find a professional. We don't all have access to that, do we? And you've developed something for a very nominal cost that somebody can then take at home and really set some intentions for these really life-changing, heart-wrenching experiences, wanting to quit smoking, wanting to associate with food differently, wanting to handle pain, being able to sleep, reduce anxiety. And that it feels like, that's why I got excited about having you on the program. It feels like you're offering a lot of accessibility, which is part of our goal at Therapists Uncensored. We want to really promote accessibility, and we're really excited about that idea.
Well, I'm very glad to hear you say that, and you're absolutely right on. And it's true. I wanted to make it available to anybody who wants it, even if people were less prejudiced against it. There just are not enough professionals who are trained to use it. So I wanted to share what I've learned. I've used it with about 7,000 people in my career. That's a lot of people, but compared to the possibility, it's very small. And so I just wanted to show people that it's safe and effective and easy to learn and easy to use. Try it and see what happens. I had a lovely young woman who came to see me because she had bad lower back disease and was pregnant. And 7 months pregnant, the bigger the baby got, the more pain she had. They couldn't use medication. Her pain was 7 out of 10 when we started. I had her imagine she was floating in a warm bath, filter the hurt out of the pain. And she opened her eyes. She said, "Hey, the pain's down to 3." And I said, "That's terrific, but you look angry. What's the matter?" And she said, "Why in the hell are you the last doctor I got sent to instead of the first?" They'd implanted nerve stimulators. None of that worked. And that's exactly it. And part of it is a business problem. Hypnosis costs virtually nothing. I don't have the money that pharma does, and I wouldn't do it anyway, to hire ex-cheerleaders to go convince doctors to use it. And so part of the problem is there's no business model for disseminating it the way there is for medications. Now, a lot of medications are very good and useful, and I prescribe them too, but it's big business, and this is not. And I want people to learn how to use what is readily accessible and available to them. And, as an example of the frustration, and my colleagues and I published a paper in The Lancet, which is one of the leading British medical journals. There were 3 arms in this randomized study. People were undergoing arterial cut downs to thread catheters into the arteries to do chemoembolization of tumors in the liver or open up artery stenosis. And it takes about 2.5 hours. It's uncomfortable. It's scary.
Do you have to be awake during this procedure?
Yes, they're awake during the procedure. Yep. And, they need you to cooperate, and general anesthesia is an extra danger that you don't really need to put people through. So one group, everybody could push a button and give themselves a dose of opioids if they were uncomfortable. The second group could do that, plus they had a friendly nurse providing them with emotional support. And the third was teaching them self-hypnosis. to restructure the pain, to imagine you're in ice water, cool, tingling, and numb, filter the hurt out of the pain. So by the end of a couple of hours, these usually take about 2.5 hours. The standard care group's pain level was 6 out of 10. The friendly nurse group, 3 out of 10. And the hypnosis group, the pain level was 1 out of 10. And they were using half as much of the opioids as the standard care group. We looked at their anxiety. And this is, 80 patients in each group, a lot of patients, big trial. The anxiety levels were 6 out of 10 for standard care, 3 out of 10 for the nursing group, and 0 in the hypnosis group. I was afraid they'd all died or something. They were just totally unstressed. They got done 17 minutes quicker on average. They had fewer complications. And so it actually saved the hospital $348 a procedure because they got to use the room more. Now, if I had published that and the thing that produced that was another drug, every hospital in the country would be using that drug now, but it isn't. It's just teaching people self-hypnosis. And we always sort of underestimate and undervalue the things that are just right there in front of us that we're carrying around with us all the time. And, this 3-pound organ we have at the top of our bodies is our major advantage in survival, but it doesn't come with a user's manual. Just because we've got it doesn't mean we know all the ways we can use it. And hypnosis has tremendous value in dealing with stress and pain, in sleep, helping people stop smoking. And that's what we teach people on Reverie. So they get to hear my mellifluous voice. They interact with me. I ask a question, is your hand floating in the air? If it is, we go on to something else. If not, we help them with that. So I tried to make it as much like the experience of being in the office with me as I could. I used to worry, was it almost as good? And then it occurred to me that if you wake up at 3 a.m. and you want to get back to sleep, you probably don't want me in your bedroom telling you how to do it. But you've got me with your smartphone. And so in some ways, it's better.
There's so much, I keep using the word agency, but that seems to be the word I want to come back to with this, because it feels like what you're setting up is this idea that through intentionality and a decision, I can be somebody, I have some aspect of being able to put my own body into a place more oriented towards parasympathetic, more open. I can use my imagination in such a way. So it's like, it's not something happening to me. It is something that I'm creating. And there's every bit as much empowerment, I think, from knowing that I can create that state. If I'm only going to see you in your office and I can't get to you, I'm like, if I don't have him in there talking in my ear and helping me have these imaginations, it sounds like it can already set up a situation where you don't have the kind of confidence or agency, and yet you're teaching people like, oh, wait, you really, through your own imagination, have that capacity. And that in and of itself puts us into a more secure, parasympathetic, open state.
That's exactly right. It's not that you're being dependent. It's you're learning to be more independent. You're learning how to control how your body's reacting to stressors, how you are reacting to stressors, how to perform better, how to focus on what you're for and what you want, how to immerse yourself in an experience to make it even better. And yes, people are gaining a skill and adding to their control. They're not being taken over by somebody. They're not losing control. They're gaining it.
Hey, every now and then we want to remind everybody that we want to thank our sponsors. Without them, we would not be able to continue to provide this free and totally accessible around the globe, all over the world. So we really do appreciate our sponsors. If you would prefer an ad-free feed, you can certainly get that at therapistsuncensored.com/join for as little as $5 a month. You can get an ad-free feed and be part of our Neuro Nerd community. But in the meantime, again, we really love and appreciate our sponsors because it gives us these incredible opportunities. And our very first sponsor ever that has continued to be our sponsor, I wanted to give you an update on them because we are continuing to use them. That is AG1. Ann and I still use it daily. It's part of our morning routine. And here's why. We want to make sure we get all the high-quality vitamins, whole food sourced superfoods, probiotics, and adaptogens we need every day. And we are ridiculously busy. So 1 scoop of AG1 in our smoothie guarantees basic nutritional cornerstones are met before we are even out the door. It is efficient, which we appreciate, and it tastes really good. If you've been listening to this podcast for a while, you will certainly appreciate how hard stress is on the body for us. And anything that we can do to reduce stress is very good. And we also, I'm sure, appreciate how important our gut biome is. And it's always really hard to figure out what to do to help your gut biome. You can definitely hear, it affects mood, it affects thinking, it affects, it's basically our second brain. But it's always hard to know kind of exactly what to do to have a good, healthy gut. Well, we turn to AG1 for that. Their parent company, Athletic Greens, keeps up with the latest science, and based on the latest data, they iterate their product to keep improving it. Plus, the ingredients are tested by a third party to ensure that what they say is what you get. So, based on my experience taking AG1 and my snooping around to make sure that they were a good company, I recommend you check them out at athleticgreens.com/therapist-uncensored. Be sure and use that link because for our listeners, they will give you a free year supply of vitamin B and free travel packs for you to be able to take this superpower on the road with you. That's athleticgreens.com/therapist-uncensored.
Hey, y'all, let's take a break and thank our sponsor, OneSkin. I love talking about OneSkin because their products make it so easy for me to keep my skin healthy. I don't love multiple step routines for anything, and OneSkin, it makes it just so easy and effective. So I just cleanse and apply OneSkin to my face and body a couple times a day, and I can really tell you how much better my skin feels. So I'm not surprised because their products are clinically proven to both strengthen the skin barrier and improve many skin health markers. I can tell you, when I use it, my skin does feel more nourished. So get started today with 15% off using code TU at oneskin.co. That's 15% off oneskin.co with code TU. After you purchase, they will ask you where you heard about them. So please support our show and tell them that Therapist Uncensored is where you heard about it. All right, thanks. Let's jump back in.
Could you talk a little bit about smoking? Because I know that's on a lot of people's minds, and it is a really, really tough habit to break. And it has a lot to do with the pressure we put on our body and the way that our mind associates with it, not to mention the physical addiction. So what have you found? And have you done any studies and outcome variables on that?
We have. We've done studies of face-to-face hypnosis. We find that with a single session of teaching people how to use self-hypnosis, we get half the people to stop right away, and half of them won't touch a cigarette in 2 years. So we get about 1 out of 4 people just flat out stop, which compares well with varenicline and bupropion and the other meds that are used for stopping smoking and Nicorette. And we found in a recent study using the app that we get 19% to stop, an equal proportion cut down substantially on the amount of cigarettes they're smoking per day. So it's about 50% reduction. So it can be very, very helpful. And what we do, and this is unusual in some ways, one of the rules of hypnosis is focus on what you're for, not what you're against. The worst thing you can tell someone is don't think about purple elephants, and that's what they're going to think about. So
don't think about that cigarette you really, really want. What you just don't think about that cigarette. Yeah.
No, you got it, Ann. That's right. That doesn't. So we don't talk about the urge. We dismiss it. We all have urges. Most of the time, thank God, we don't act on them. So instead, there are 3 things that I teach people to think about in the hypnotic state. 1, for my body, smoking's a poison. 2, I need my body to live. And 3, I owe my body respect and protection. So you're focusing on what you're for, not what you're against. You're making a commitment to respect and protect your body. I tell people, would you ever think of pumping tar and nicotine-laced hot air into your baby's lungs or your dog's lungs or your cat's lungs? Hell no. Well, you know what? That's what you're doing when you smoke a cigarette. You're forcing your body to absorb these poisons. But you say, but it's me. It's not you. It's your body. And you may decide at some point you want to stop and protect your body, but it may be too late for your body. You may have done too much damage. The other thing that's nice about this is by focusing on what you're for, you can feel good from the minute you start making that commitment. I'm doing something good for my body. I'm being a good parent to my own body. And that allows you to have what we know is the best way to change people's behavior: intermittent positive reinforcement. You feel good about it right away. It's not that I'm depriving myself of something. I don't need it. I'm focusing on what I'm for. So that approach gives people a substantial opportunity to protect their body from the poison of smoking and feel good while they're doing it.
Yeah, it immediately reduces the idea of shame. Instead of, I'm so bad for wanting this, I'm so weak, I can't do this, which of course is then just activating all of that part of self-protection. Now you feel bad about yourself, and so now you need to protect yourself. And by focusing on all the positives, what I want to give myself, it's very self-caring and non-shaming.
Yes, I'm glad you see it that way. It is. And you're focusing on what you're for and on conceiving of yourself in a different role than most people think about in relation to their bodies. You're your body's own parent. So it is totally dependent on you for whatever gets put into it. So be a good parent and do for your body what you naturally, instinctively do for your children or your pets.
Well, and as you speak, of course, I will say that I've been on the Reverie app, and I will say your voice is quite hypnotic. So there is a wonderful way of just your voice kind of entering in. I have to say that there's, but I think also if all of us can imagine a time when we are trying to learn something or try to do something, and we have somebody in the left ear going, "You're never going to do it. You can't do it. You kind of suck. You have no willpower." Just tuning into what happens in your body, you can feel the sort of drop and imagine your voice or, somebody kind going, "You really deserve a healthy body and you really care about yourself and we really can help you get there." It's like immediately you can feel your motivation go up and your body expand and your desires expand. It's what we call in our vernacular secure relating. We're trying to help people focus on how to relate more securely to themselves, so therefore they can relate more securely to others. And so it's like a secure way of relating to yourself by focusing on what you're wanting and what's good and what you deserve.
That's a very nice way to put it. And I do try to, in my own relationship with my patients, and sort of model for them, can you do for yourself and your body what I'm trying to do for you, which is show you how to experience yourself in a different way that frees you to do things you've wanted to do but haven't been able to do. And so I'm hoping that, modeling this as offering people a way to discover and utilize an innate ability that they may not have recognized is also, as you say, modeling a kind of relatedness that is nurturing and sustaining rather than confronting.
Can we jump into discussion about trauma? Because there is an element of hypnosis and trauma that there's a sense of dissociation. And often when we've experienced a really difficult experience and we dissociate from it and it gets stored in a different part of our mind and we kind of distance from it. And hypnosis is kind of another way that we're offering ourselves an ability to distance from an experience. Can you talk a little bit about what you guys have found with hypnosis and trauma?
I think part of why we have the ability is that there are times when getting the big picture is not the best thing, when you just need to survive, when pain or fear or both are overwhelming and you need to disconnect from enough of it that you can get yourself safely out. I had a patient who was in the World Trade Center when it was attacked, and she said, I was just getting down the stairs, putting one foot in front of the other, and I told myself, if you just get to the ground floor, you'll be okay. And she got to the ground floor when the other building collapsed and she was blown out through the window. And thank God she survived it. But she was angry at herself for deceiving herself. And that's an interesting thing, that for all kinds of trauma, people blame themselves for events that they didn't control. We'd all rather feel guilty than helpless, as you know, as a psychotherapist, that people will inappropriately blame themselves, people who have been physically abused or sexually abused or in traumatic situations, somehow comforting to think, well, I could have done it differently and this and that wouldn't have happened.
We want to believe we have control over something. And so if something happened to us, we must have done something.
Right. I had a woman, she was a victim of an attempted sexual assault. It was getting dark. She was coming home from the grocery store with her arms full of groceries. And this guy jumped her and wanted to drag her upstairs to her apartment and rape her. And she fought him off and got a basilar skull fracture as a result. She had a seizure. The cops came. They didn't think much had happened, and they were about to leave when she had a seizure, and they took her to the hospital. And she was angry at herself for getting herself so badly hurt. So, one of the things about hypnosis is because it's so controlled, you can dissociate, but you can, in a controlled way, decide, okay, for a few minutes, with my body safe and comfortable, I'm going to learn something about what happened. So I had her picture what was going on. She wanted to see if she'd get a better view of his face. It was getting dark and she couldn't see much more. But she said, what I realized looking at him is he doesn't just want to rape me, he wants to kill me. If I get upstairs, he's going to kill me. And you could argue, well, thanks very much, Doc. I felt bad enough as it is. Why, And then I said, I want you to picture one thing you did to protect yourself. Because everybody in situations like that engage in some strategy, even if it's just being quiet and not moving or something. They do something to try and protect themselves. And she said, you know what? He's surprised. He didn't think I was going to fight that hard. And so she came out of it with a different view of what she had done. Not that she had gotten herself hurt, but that she had saved her life. So it enables you to, on the one hand, face something that's even worse, but on the other hand, emerge from it feeling good about yourself instead of guilty and bad. And so it can be a controlled way. Many of the treatments for PTSD involve exposure and cognitive reframing of what happened. And this is a way of doing it in a rather controlled way where your body is safe and comfortable, but you're picturing something and learning something about the situation and what you did. So I found it can be very helpful to people, even with these very painful and difficult life situations.
It really strikes me in that situation that when we are deciding to recall the trauma, and I'm glad she was doing that with you. That's one of the ones doing that at home for me might be a difficult. I imagine if you're trying to deal with some really serious trauma, going in and seeing somebody with hypnosis that is really well trained in the experience of trauma, that then she's going to making the decision to go through that process and having some agency, if you will, to be able to go through it, but with somebody kind and soft and safe as you would be, I can imagine, in the office, then she's able to look at it and separate from her experience and see herself in this more powerful way, that she did fight back and that she had that sense of self. Yeah, I can.
We were the other day, the Department of Psychology at Stanford asked a bunch of us who deal with trauma to talk, given all the horrible trauma that's going on in the world now, talk about what it's like. And I told that case history, actually, and one of the bright young professors in the department says, often the standard assumption about people with mental illness is that they're sort of broken and you try and fix them, get them back almost to where they were. And he said, there's something about that narrative I don't like. And that is that maybe people learn something about themselves in which they discover that they're better than they thought they were, that it can be a kind of resilience training, not just repairing damage. And sure, there's damage to be dealt with. And he pointed out that example. He said she learned something about herself that she didn't realize, that if she needed to, she could fight harder than she ever thought she could to save her life.
That she was not damaged. She was very powerful in that experience.
That's right. And so I think that's true, that the advantage of being able, on the one hand, to face things like this in a contained, controlled way with appropriate psychiatric or psychological support, absolutely, also means that you can see things about yourself that may be not just not worse, but better than you thought, that you learn something about yourself. And, a lot of combat vets feel that way too, that they've learned something about themselves and what they can do. So the ability to look at something, control your reaction to it, control your body's reaction to it, but also let go of your standard presuppositions about who you are and what you are, can be a powerful agent for change.
Now, not everybody can be hypnotized. Is that right? There's the whole theory around, like, if you're in an audience, that they're really kind of paying attention and they can figure out. And let me tell you, I want to ask you if this is true, that they can see the audience and they watch the audience and they can figure out who in that audience before they pick them are more likely to be able to be hypnotized. Is there accuracy in that?
Oh, yeah. They do it in two ways. So one is while they're giving their spiel at the beginning, they'll be standing up on the stage and they'll start swaying back and forth. And they're looking for people in the audience who are swaying back and forth with them.
I'm wanting to sway right now as you're doing it. He's doing it.
Good. There you go.
Listening, he's
Come
swaying
on up. So they invite them up, but then they also try a few things, and they'll be sort of going through maybe 8 or 10 people before they settle on the 3 or 4 that they want to actually do the big show with. And so they'll try out. Some people will respond, some won't. Not everybody is equally hypnotizable. About 20% of the population adult population is just not hypnotizable. About 60% somewhat, and another 20% at the other end are extremely hypnotizable. So most people are to some extent, but there are some people that just flat out are not hypnotizable.
That's so interesting. Have y'all ever done brain studies on the differences between those that are in that 20% that are just not and the 20% that are extremely?
Yeah. Yes, we have. And what we find is that we screened before and took the extremes, people at the high and low ends, and put them in the scanner, didn't try to hypnotize them, just put them in the scanner. And what we found was that the highly hypnotizable ones had greater functional connectivity. When one region is active, the other is, or vice versa, between the executive control network, the dorsolateral prefrontal cortex, and the dorsal anterior cingulate, the salience network. So if the part of your brain that's thinking about or doing something is tightly coordinated with the part of your brain that worries about whether you should be paying attention to something else or not, you're more likely to be highly hypnotizable. And in fact, it turns out that higher hypnotizability is associated with more binding of gamma aminobutyric acid. It's the inhibitory neurotransmitter that the benzos, like alprazolam and other benzodiazepines, actually trigger release of. So they bind more. So you've got your own little internal pharmacy there that allows that part of your brain to settle itself down more, to calm down, as if you're taking your own anti-anxiety drug, only it's all right in your head to begin with.
Oh my gosh, it's so funny. I have this secret desire, although we are doing a book, I have a secret desire to, I've mentioned this before on the podcast, to have the title of the book, Become Your Own Drug Dealer.
Yeah.
Becoming your own drug dealer. So like that there's so many self-activating things that you can do to activate the different parts. Someday I'm going to have a book entitled that. But it's such a great example.
It is, but we actually have on Reverie what we call the hypnopharmacy, which is you tell us what's troubling you and what kind of problems you're having, trouble sleeping, anxious, pain, and we give you a prescription that is how to use the app to deal with the problem that you need help with. So I hope you don't mind that we've stole that part of it, but we've got our hypnopharmacy. And you're right. These drugs work because they connect with what's going on in your brain, and sometimes that's enough. And sometimes with pain control, we have people imagine they're floating in a bath, warm bath or ice water, filter their head out of the pain, and we change activity in the brain. We reduce activity in the parts of the brain that either process the sensation of pain or process the amount of distress the pain causes you, different parts of the brain, depending just on what you tell people. And that's what hypnosis allows you to do.
So what about the 20% did you find that are not hypnotizable? Because I'm gonna tell you that I have this like secret thing when I was looking into this, like, do I want to be hypnotizable? Does that mean I'm weak? Does that mean that I'm so easily manipulated and suggestible? And I'm probably not the only one out there going, do I want to be? Is that a good thing?
Well, I think actually it's I'm guessing you are at least somewhat hypnotizable. And it's part of what makes you a good therapist, because it's easy to tune into other people, to get the feeling of what they're feeling. Part of what goes with being highly hypnotizable is you can sort of easily take on what somebody else is mentioning might be a new way to be. Well, just engaging with a patient and learning about them and learning how they deal with their problems kind of pulls you in, and you can connect with them because you can not just think about it, but you can feel it with them. So, they become your movie and you engage with it and become part of it. You begin to feel what life is like from their point of view, not just yours. I sometimes find when I'm treating people, and that I'm sort of a spectator at my own movie, because words come to me about what's the right way to formulate this that touches them and connects with them. And it's not like, I have this list and, one from column A and one from column B. And you may have that experience too. There's an old saying that it's a smart hypnotist that knows who's hypnotizing whom, and I feel sometimes that I engage enough with people that I kind of know what they need to hear. I had a patient who had a terrible boss and struggles about her job and all that. And she said that the thing that I said to her at the previous session, that while I admired her courage and perseverance, sometimes the best thing to do is recognize that you're in an impossible situation that's not going to get any better and get out of it. And she said that allowed me to just stop punishing myself for not having succeeded and seeing it as the best thing I could do to get out of a situation where there was no possibility of succeeding. So what seemed like a sad thing began to feel like a liberation.
And it sounds like what you're saying is you just flew with her in a way. It was just like you were with her in a space. You weren't prepared to say that. I need to say that. It just kind of happened in flow with your sense of connection with her.
Yes, that's exactly right. And so I was using parts of my brain that I didn't know I was going to be using to connect with hers. And you're allowing yourself to emotionally and deeply experience what life must be like for them. And therefore, hopefully find something helpful to say in response. And that's, I think, part of what good therapy is about, is just being able to deeply connect with people and say things from their point of view more than yours.
Well, it sounds like, in a way, hypnosis is about kind of being able to do that with yourself, being able to see that experience and travel and care for yourself.
The analogy that comes to mind when you mention travel is, we all like to have the fun of going to a different culture, a different place, and see things differently where you don't know exactly what's going on. And you miss half the fun of a trip if you don't let spontaneous things happen. You see some little store or some little street or something, or you take a hike you hadn't planned on or something, and you don't know what's going to happen, but you let yourself get into it. And I think that's true with people too, that you allow them to guide you in directions you didn't think you were going to go in, and you hopefully do the same for them. But it's not being so formulaic and controlled that you can't let yourself open up to an experience with someone else and learn from them and let them learn from you.
So it's about an opening. So before I let you go, what about those 20%?
There are a couple of things. One part of it is genetic, and there's a gene for dopamine metabolism. Dopamine is one of the primary neurotransmitters in the brain. It's been called the feel-good neurotransmitter, the mesolimbic region. It's gives us pleasure and all that. And there's a gene called catechol-O-methyltransferase, COMT. It gives you the best dopamine levels if it's not metabolizing dopamine too fast or too slow. So you don't have too little or build up. And either way, you can get too little. You don't produce enough or you don't degrade enough, and you don't have the right balance. So people who have a particular variation of that gene, methionine and valine, sort of heterozygous rather than homozygous, turn out to be more hypnotizable. And we actually developed a bedside test, just a little drop of blood. We can measure it and see whether you're likely to be more hypnotizable. But the hypnotizability test we use is the one that usually is the easiest way for us to tell how hypnotizable you are. But there are developmental things too. Most children, most 8-year-olds are in trances most of the time. You call your kid in for dinner, he doesn't hear you, he's out playing. But we tend to lose hypnotizability when we go through adolescence. And Piaget talked about developing formal operations where you tend to value logic more and experience less over time. By the time you're 21, your hypnotizability is as stable as your IQ over a 25-year interval. It doesn't change.
I was going to ask you that. So it's not necessarily something you can teach yourself to become more hypnotizable.
No, you can't. Although we just published a paper in Nature Mental Health showing that we can use transcranial magnetic stimulation to suppress activity in the dorsal anterior cingulate and at least transiently increase hypnotizability, which has not been shown before. But at the same time, there are also developmental reasons for it. People who have suffered, trauma in childhood often hang on to their hypnotizability because it's a way of detaching, as you were saying before, from painful experiences. You don't want to lose it. The other is positive, and that is children who have a lot of imaginative involvements, whose parents read them a bedtime story every night and that kind of thing, also usually turn out to be more highly hypnotizable. So some of it is development, but some of it is also genetic, the way in which you metabolize neurotransmitters.
So my last question for you, I know I could probably talk to you all night. I have so many questions, but I'm going to have to call it. But I'm curious if there's ever been a study about hypnotizability and attachment histories.
There probably has. I can't think of any at the moment, but I would imagine that people with, in terms of that developmental thing I was talking about, people with secure attachments, I would think, would feel more comfortable letting themselves go. And in a relationship, they learn from early on that being on defensive makes you closer, not lets you get exploited in some ways. So I would think that secure attachment might be one precursor of higher hypnotizability. You shared imaginative experiences, that kind of thing. Now, you could argue that, maybe destructive attachments could also push you in that direction. You don't want to let go of it. But I'd be more inclined to think that it's the secure, because I think, with children, what does secure attachment mean? It means that when you separate a young child from the child's mother, she doesn't freak out. She's sure mother will come and get her. And, she has that security. So she's in essence keeping her mother alive in her imagination while mother is not there.
That's true. She's holding self. I kind of wonder, and if you think about it, because the preoccupied, when you lean a little preoccupied, you have sometimes an overtrust of others and a little undertrust of self, which could make it more likely. So I find myself curious where sometimes when people are more in the dismissing have kind of a distancing experience. I've got this, don't tell me, So I'm going to be a promoter for you guys to consider that.
Thank you. Well, it's a very interesting thought. It really is. Yeah. Yeah.
We're going to have all your contact information, including the ability to find your Reverie app in our show notes. But many people don't ever touch a computer and they just listen. How would they be able to track you down and your Reverie app?
Well, there are two ways to get to us on the internet, just www.reverie.com. And you get a much fuller description of what Reverie is, how to use it, and how to download it to your phone. REVERI, no E at the end, but like dream, except without the E at the end. REVERI. And you can download, if you have an iOS phone, from the App Store. Just go to Reverie and download the app there. Or if you have an Android phone, at Google Play, same thing, just download Reverie. And so the app will live in your smartphone. Press the button, and anytime you want, you got me. And ways of solving a whole bunch of problems that you may need help with.
If somebody wanted to dive a little bit more, of course, there's all this web search you can just independently do. But if somebody wanted to dive into a little bit more of the outcome variables from your clinical studies, where would they find that information?
Well, that is also on the website. So we have an area where there are a bunch of the papers and references and things like that. So if you want to learn about hypnosis for pain, stress control, insomnia, stopping smoking, eating more sensibly, we didn't talk about that, but people can learn to eat like a gourmet and enjoy eating more even while they eat differently. So there are lots of places to go from the website, and you can learn a lot more about it.
All right. Thank you so much for joining us. We just learned, I know I have, and I know the listeners have learned a great deal from you today. So I really appreciate you taking the time and jumping on with us.
My pleasure, Anne, and I thank you for your interest and understanding of what we're trying to do. That's great.
All right. Thank you guys so much for joining us. If this material is helpful to you, please take the time to pass it on to somebody else that can really use this information, and to rate and review us, because that always helps people find us. Thank you so much, and we'll see you around the bend.
Therapist Uncensored is Ann Kelly and Sue Marriott. This podcast is edited by Jack Anderson.